In this video, let us see about Raynaud's syndrome and how to answer if it is asked as a 5-mark question. So before starting, for any 5-mark question or 10-mark question, remember you have to write a synopsis mentioning what you will discuss in this answer. Like it will give the person who corrects the answer an idea of about it. So definition will be for all the common and major diseases, causes and epidemiology, etiopathogenesis, types, classification if it is present, clinical features, investigations, special laboratory investigations if anything is present, and treatment or management. So for this Raynaud's phenomenon, let us see the following subheadings. Raynaud's phenomenon is an episodic vasospasm. You saw in the initial picture, the fingers are blanched here. It is pale and white here because of vasospasm. So we'll see about the other clinical features also. Episodic vasospasm, it returns to normal. It is of arteriolar in origin. It is not venous in origin. It is arteriolar in origin. The sequence of clinical features will lead to what we call as Raynaud's syndrome. So Raynaud's phenomenon means episodic vasospasm. It is arteriolar in origin. The sequence of clinical features which follows this will lead to what we call as Raynaud's syndrome. It is seen in females. It is usually bilateral in occurrence, that is both the hands, and the site is usually upper limb, hands. Okay, for other peripheral vascular diseases it can happen in legs also. Here Raynaud's phenomenon usually happens in upper limb, that is hand, usually bilateral in origin and seen in females. It is present in hands with normal peripheral pulses. Since though there is vasospasm, the peripheral pulses which you examine will be usually normal, unlike in other disease we'll see. Etiopathogenesis, there are many factors. Raynaud's disease, what we call as Raynaud's disease, means there is arteriolar vasospasm. Usually upper limb is affected, which we saw earlier, and it is due to abnormal sensitivity to cold. If it is present because of this reason, we call it as Raynaud's disease. Working with vibrating tools is also a common factor, precipitating factor. Vibrating tools means the drilling machine or in fishing boat, if they often use it, it may be associated with that. It is also known as vibration white finger by layman. Collagen vascular diseases, including autoimmune diseases, scleroderma, and all the diseases which cause vasculitis, may also precipitate Raynaud's phenomenon. Crest syndrome, the R in Crest syndrome stands for Raynaud's phenomenon, and cervical rib or Scalin syndrome can also cause this. The clinical features are commonly blanching, cyanosis, and flushing. Blanching is nothing but because of vasospasm in the digits you will have the change into pale color, after which the accumulation of discolored blood will cause cyanosis, bluish cyanosis, after which the return of blood after the vasospasm gets over, there will be flushing. In the flushing phase, there will be pain, usually because of increase in tissue tension. If spasm persists after blanching and cyanosis, you will get gangrene. If the return to normal is not seen, gangrene may occur in the tips of fingers. So this is called blanching is because of the local syncope. Cyanosis is because of local asphyxia or accumulation of impure blood, deoxygenated blood, and flushing is due to the local recovery because of spasm being reversed. And if it is not going to be reversed, it may cause local gangrene. So these are the clinical features simplified for you. Kaufman gave a criteria for Raynaud's phenomenon. So what we saw till now will be given in point-to-point basis. Episodic attacks. So it should not be a continuous spasm. It attacks you in episodes. And it is a well-demarcated, reversible. You could see the difference. You could see the well-demarcated means here you could differentiate between the normal part and blanched part. So it is a well-demarcated lesion, right? So well demarcated and reversible lesion. Self-limiting color changes. It changes on its own, self-limiting. So for 1 to 20 minutes it usually happens on exposure to cold or emotional stimuli. And is symmetrical, bilateral, both it appears same in left and right, lasting for about 2 years. For past 2 years the patient may be suffering from this. So these factors, these criteria If it is present, it will be considered as Raynaud's syndrome. Classification of Raynaud syndrome, it can either be vasospastic or obliterative. Raynaud's can also be classified as primary or secondary. In primary, there is no underlying cause usually. Pain is also not that much, but in secondary Raynaud's syndrome, the underlying cause is present, like the use of vibrating tools or the use of the other diseases, autoimmune diseases. They are the underlying causes for Raynaud syndrome. So in the recovery phase, in flushing, there will be significant pain. Differential diagnosis. Thromboangiitis obliterans is another peripheral vascular disease. TAO is mainly caused by smoking. In TAO, peripheral pulses are usually absent, but in Raynaud's phenomenon, peripheral pulses are present. So the differential diagnosis should be based on this. Other factors are also there which differentiates TAO. We'll see about those factors in the video on TAO. And investigations, usually since it is a vascular disease, angiogram of hand, either digital subtraction or MR based angiogram, arterial Doppler or duplex scan. Since it is associated with autoimmune diseases, anti-nuclear antibody assay, and special tests include fingertip thermography, reactive hyperemia time, nail fold capillary microscopy. The normal values are compared with patients suspected for Raynaud's phenomenon. So treatment, how you will treat. If there is an underlying cause, treat it. So if you cannot find a cause, just avoid the precipitating factors like cold or vibrating tools. Medicines include vasodilators, low dose aspirin, and other nitrates and other drugs. So these are all useful in managing a Raynaud's phenomenon. So this is what you will write for your 5-mark answer, and with this you can also answer your Viva questions. So all the best, keep learning.